Hey guys, this is Jamie with Birth and Confidence, and I'm doing some lunchtime video series on some topics that might come up prior to you attending a childbirth education class. So the one today is going to be on choosing your care provider. This is a really important topic because your care provider is one of the most important people in your pregnancy and during your birth experience. And so a care provider, whether it be a midwife, an OBGYN, or a maternal fetal specialist, is a critical component to you walking away from your birth experience feeling like it was a positive one, no matter what happens during it. So it's so important for you to find a care provider that melds with your goals and your expectations for your birth experience, and also you trust is going to make the right decisions based on those goals and motivations that you have during times where you all might have to make medicalized decisions about your pregnancy or birth. So there's a couple of questions that I would consider asking your care providers when you're interviewing them. Yes, you interview your care providers. These are people that are going to be assisting you in having a safe birth and are assisting you in meeting the goals of that birth. Nothing is wrong with you. This isn't like you are going into the ER and you just choose, you get whatever doctor you get because there's no time to lose. You are usually a very healthy pregnant person who is very capable of making decisions and having some time to think through those decisions. And so you can definitely sit down and have a more formal conversation with the health provider that you're thinking of hiring to assist you in your birth experience. Do it outside of the medical exam. Be in your normal clothes, not in a gown as a patient. Sit down with them and ask them questions that you think are going to be important to you to decide if they are the right care provider to see you through your pregnancy and your birth. So the first question that I want to leave you with today is to ask your maternity care provider, what are their core values, priorities, and goals for their pregnant women? What do they see as being critically important to the care that they provide? What is their general philosophy about birth? These are really critical questions to ask to make sure that their answers meld with yours. So don't lead them towards an answer. Ask them this question and sit silently and listen to what they have to say. And then listen to your gut. Does this ring true for you as well? Are these things that you also care about? Or do they seem to be on a different level than you? And if so, they probably are not going to be the right care provider for you, and it's time to keep shopping. The other second question is kind of a follow-on to that, is who else in the practice could be providing me with my prenatal care or attending my birth? A lot of practices have more than one care provider, more than one midwife or OB, and how would you get to know each one of those folks that might be attending your birth instead of the one you're talking to at the moment? And how are they assuring that their philosophies, priorities, and goals are the same across the entire practice? How did they choose to come together as a partnership? And what happens if you do get somebody who doesn't have the type of experience that's needed for the type of pregnancy that you have? So for instance, in some practices, there are OBGYNs that feel comfortable delivering a breech baby and others that don't. Well, on the day, your baby isn't going to choose when it's born based on when the provider that can do a breech delivery is available. So what are the alternatives that you have, and is there a practice in the community that feels comfortable across the board in breech delivery? So these are really critical questions because as your pregnancy moves on, you're going to find yourself getting a little bit more anxious about who is in the birth room with you, who is in your labor and delivery room, who's delivering your baby. And so making sure from the very beginning that you're finding somebody that melds with your philosophy and the goals for your birth experience will make the end of your third trimester a lot more relaxing and less stressful. So that's my tip for today. I'm going to share a link with you as well for a bunch of questions that you might want to ask your care provider in that first to second trimester. And good luck to you and congratulations. And I hope to see you at a birthing confidence childbirth class sometime soon. Bye.